Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, Patti will join me in a few minutes, and we're going to talk about, well, what's going on in the state capitol. But first, telehealth, what's that all about? I have a physician who's going to explain that and more.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, if you haven't checked lately or called to see a doctor or checked into a hospital, you know that there are huge changes taking place in the healthcare profession, how healthcare is delivered. Joining me to talk about one of them, and before I'm finished, I'll get him on to some other subjects, is Dr. Michael Consuelos. He's the Senior Vice President for Clinical Integration at the Hospital and Healthsystem Association of PA. He has his title as long as I do back at Franklin and Marshall. We love these long titles.
We do. Don't wait there. Thank you.
Hey, doctor. Look, thanks for coming on. First of all, telehealth, it looks like to me, is a way to assist doctors in providing, and hospitals, in providing health care in a variety of circumstances that all this modern technology permits them to do. Am I right about that?
That's absolutely correct. So traditionally, it's been a face-to-face like we're doing right now. And I think, thankfully, with new technology, everybody's using their cell phones, their iPads, and other devices. Medicine is moving along just the same way. So we can start delivering care just like we do face-to-face in a more remote way.
Yeah.
And it's important, especially in rural areas where it takes a long time to get to your physician.
And you also have a shortage that folks from HAP have been on the program on many times. We've talked about that along with folks from the PA Medic. The shortage physician, particularly in rural areas, that's another aspect of this, isn't it?
It's absolutely correct. So as a state in Pennsylvania, per capita, we're doing pretty well with physicians, per 1,000 people, but there's a distribution problem. Physicians are basically concentrated in our urban, suburban areas. So in rural areas, that percentage really drops off, and that's where we're having problems.
All right. Well, then, when you use the term telehealth, what does that mean?
Right. So telehealth is really a term that gathers a lot of different ways that we can interact with patients remotely. Okay, so that's what the tele means, right? So it's not just telephone. It could be visual. It could also be something what we call save and store and move ahead. So basically, you could take a picture of something and show somebody. Right. I'm
going to hold this up when the camera will come back. Hold this up so you can talk and you can see.
Right.
I mean, this is something.
It's great. And so, for example, in our rural areas, if you unfortunately had a burn on your hand, right now, there's possibility of actually the ER physician being able to take a picture of the burn, sending it to a burn surgeon, a specialist in that area who say, okay, here's how you would treat this, and you don't need to move the patient hundreds of miles to see a specialist.
Yeah. Now, let's talk a little bit. You just talked about one practical use for it, but obviously, it could be hugely helpful in saving a life. But talk about routine care, as you say, because of the distance. And then the other aspect is more and more because of the influx, because of the larger number of people that have, medical coverage, insurance coverage. More folks are seeing physicians today, which means you make the phone call, you want to get in to see your doc 5 weeks, 4 weeks, because of the huge crush. And the same, I think, is true in some hospital cases.
Right. So for example, so let's take a use of a chronic illness. Let's say chronic heart problems, right? So you want to see that person pretty frequently to manage their heart problems, and it may take a long time. Yeah. But with telehealth, the patient can stay in the comfort of their home, load up all their weights, their blood pressure, their heart rate, their oxygen level, and that could be then given remotely to a physician. And that visit could happen remotely, saving time, saving money, but also, as you mentioned, saving the problems that we have with waiting times.
Yeah. That's an important component. So let's talk. There are some things terms that I'm hearing for the first time.
Sure.
Telestroke, teledermatology, and here's one, you're really going to have to explain this, Jeff Connect.
So Jeff Connect is actually a program by Jefferson Health, and that's specifically what they're doing in their community to reach out to their patients in a more timely fashion using telehealth. Telestroke is basically an example of of a technology using telehealth to basically take care of patients who are having strokes in a remote emergency department. So they can actually be interviewed, and a neurologist or a neurosurgeon specialist in a remote place can actually go through a neurology exam, talk to the ER physicians, and determine whether or not they need, that's not a stroke, thankfully, but if it is, they can get into their hospital as quickly as possible.
I get it.
And then totally telederm is, again, the picture of
I'm going to go right here. If you have a mole, go ahead, take it from there.
Exactly, and then you take a picture of it, you send it forward, high resolution, high definition picture to your dermatologist. Dermatologist can take a look at it and say, yes, Tony, it's fine, don't worry about it, stay out of the sun, use sunblock when you play golf.
Got it. All right, we're going to run to a break, and when we come back, we're going to talk about legislation that I think may help implement telehealth a bit more. We'll be back after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, now celebrating 100 years as the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Well, welcome back. I'm talking with Dr. Consuelos. He's a Senior VP of Clinical Integration with the Hospital and Healthsystem Association of Pennsylvania. We're chatting about something called telehealth. We're learning about the opportunities, but it's also going to require legislation in order to make sure that there's insurance coverage and some other aspects of it. It is not inexpensive. Did I get that about right?
Yeah, that's about right. That's exactly right. So 29 other states have legislation that define what telehealth is, but also require payers to reimburse professionals for their time and effort around telehealth. So thankfully, Senator Vogel and Representative Quinn have been pressing forward for legislation here in Pennsylvania to determine and describe what is telehealth, so that we're all singing off the same song sheet on describing it, but also then requiring payers, private payers, to reimburse providers for, again, their expertise and experience.
Some do now and some don't.
That's correct.
And this would require them?
That's correct. So it's not uniform. Some payers do provide, Medicaid does provide some reimbursement for telehealth services, and it's a sort of uneven ground.
But it only makes sense. I mean, as the host, I try not to get too involved in taking positions, but if some do and some don't, but yet you're seeing a doctor, or you're getting some assistance from an organization, hospital, healthcare clinic, whatever, that supplies you with healthcare, and if you were to show up in person, it would be covered.
That's exactly right. So you
actually are almost in person anyway. You're just doing it.
That's exactly right. Your point is on spot. So you're paying a professional for their expertise and their time, right? Yeah. So they could be seeing a patient real life, or they could be a patient through telehealth. You're still paying them for their professionalism, for their training, and it's not an inexpensive use of their time. The technology is not inexpensive either.
Of course.
So it's important to reimburse providers for that.
All right, let's talk about. First of all, as you point out, this is not totally new, and it does have an aspect of quality care. That's the one thing that I think we all have to be careful about, that switching to this en masse, I'm not just talking about an occasional use of it, does raise the question. Quality of care. talk about a little bit about that.
Yeah, so there are studies that show that in specialties like dermatology, like stroke, that you actually improve quality. So time is sort of brain cells, right? So if you have a stroke in an outlying area, you want to get that patient to therapy as quickly as possible. So not only is it the same quality as seeing a physician in real life, but you're actually getting a patient to treatment faster. Okay, so and
that mole, improves the quality.
Exactly. So that mole that you may have to wait a couple of weeks or months to be seen, you get that determination right away, right? So it's the same thing, but you're getting it faster.
So if a doctor sees something he doesn't like, he says, "Get your butt in here,
Correct.
Right? Get in here now. We need to see," instead of waiting the 4 or 5 weeks, and it might make it easier for some patients. Getting around is not easy for many senior citizens, just
Correct.
having access. So this makes that a lot easier.
Yeah, and we have examples where, so in rural, we talk about rural areas, but also in urban areas.
Yeah.
Imagine kids in inner city schools with parents who work hourly jobs,
that's
right?
another great point.
Right, exactly. So they have to leave work, take their child maybe for something that's a cold or runny nose, but now we actually have physicians who are working with school nurses using telehealth, and they have electronic, otoscopes
You're
and everything else.
improving the quality.
Exactly, and you're keeping the child in school, and you're keeping the parents at work.
Gee. All right, last question before I let you go. You're licensed to practice medicine in Maryland. Can you provide medical services in Pennsylvania? Does that require legislation?
Right, so it's a great point. So right now we have both Senator Killian and Representative Topper who are trying to introduce interstate medical licensure legislation, a compact, and because you have to be licensed in both those states that you mentioned, so Maryland and Pennsylvania, this interstate compact would allow, it sort of expedites the process. It makes it easier for physicians to be licensed in both states. And that would make telehealth easier to do.
Great update. All right, you're going to keep us informed about this, right?
Absolutely.
All right, coming up, Dave, Patti, we're going to talk about what else, the state legislature, state politics, and we'll see what else we can squeeze in, and we'll do all that in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit betterwithcoal.com.
Welcome back. Well, Dave Patti, he's president and CEO of the Pennsylvania Business Council, joins me. We've had a rare moment of bipartisanship break out in the legislature. Last week, of course, it was, an expansion of the sale of beer and wine into, private venues, restaurants and other box store, other venues, right? And now we have had what?
Some pension reform this week in the House, passed on by a large bipartisan measure, went to the Senate.
Yeah, and the pension reform would do?
Well, this is called a hybrid. So it says that we will use a blend of both defined contribution and defined benefit. Defined benefit being the traditional pension where at the end of your career, you expect to get so much money for each year of service.
Yeah.
And so what this legislation would say is, well, for the first $50,000 of your income from the state or from a school district, that money will go still towards a defined benefit system,
right.
But any money you earn over that as your salary increases will then go into a 401k stock program.
Now here's the debate. The debate, and Governor Wolf is on board with that. And I'm going to come back to a little history about this last year, but before I do that, here's the debate. The pension, if everybody who's a state employee or a school district employee would say, I'm retiring, they owe, let's pick a number, $50 billion. You comfortable with that?
Right. Yep.
$50 billion. Taxpayers of the state on the hook. Am I right about that?
Yes.
On the hook for that. Now, critics say this only handles $5 billion over the next, 30 years or so, and that it doesn't go far enough. The other side says, well, look, over time, earlier pension reforms will help the situation out and the debt won't be as great. Is this a temporary solution? What's your sense?
Well, first of all, it doesn't mean that we couldn't revisit it in a few years, maybe with a different governor. So I think there is that thought, that take what you can when you can. But I also don't think, frankly, that the Senate is going to pass it exactly as is. I think the Senate...
But they did 6 months ago.
Well, I think in the Senate there's a mood to make this a little more aggressive.
Okay.
Now, how far they can go and still have the House agree to it when it comes back, I don't know, and still have the governor on board. But I wouldn't be surprised to see the Senate try and tweak it a little bit, make it a little bigger savings for the state.
Okay.
There is no way in which we can save a lot of money fast. I mean, just the numbers are what the numbers are. As you said, we owe those who have been in the system those funds. And I think it's important to always say that all of the state beneficiaries, state employees, the teachers, they paid their share.
Yeah.
So a large measure of our problem is that there were years that the state did not pay its share. The employer did not pay its share. And then there's just the way defined benefit works is that you're counting on the markets. And who would have thought two huge events in one decade?
That's right. And the amount of money that at least one of the pension funds expected its return on its investments have been downgraded a bit. So that means less money coming in.
But there was a time when we all would have thought that if we were going to put money into long-term investments in the stock market and everything, that a reasonable number was 10% a year.
Yeah.
Now we're thinking 3% a year.
We'd take, every one of us would buy a certificate of deposit backed by the government at 10%, wouldn't we?
In a heartbeat.
In a heartbeat, yeah. But here's what's surprising about this. Last year, the Senate Republicans and the Democrats and Governor Wolf agreed to the very two things we're talking about, this partial liquor privatization and what? And the pension reform. It was the House that wouldn't go along with it. Now it's the House.
Well, I do think the House is starting that, and a little taste of bipartisan cooperation last week on liquor, and they enjoyed it and enjoyed the accolades from the media and from the public and from the fans. And I think they're thinking, hey, let's stay with this. In this era of good feeling, what we have to add is also the huge news that we're going to get the ethane cracker from Shell. Yeah. And that changes the economy of Pennsylvania going forward. That's worth jobs instantaneously for construction, but that's worth a lot of jobs.
We're going to a break. Now, he brought this up, the cracker plant out in Beaver County. I'm going to make him explain it to you all in a minute. We can't have this show without talking about the budget, and we'll do that back at a second. The state budget, back at a second.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Well, I'm chatting with Dave Patti from the Pennsylvania Business Council. We're talking about all things having to do with the legislature right now, this rare moment of bipartisanship on two issues. We talked about liquor privatization and what's known as pension reform. And Dave, you brought up the cracker plant out in Beaver County. So what does the cracker plant do?
Yeah, these are not the little biscuits you put cheese on. We're talking about chemicals taking natural gas, which is actually a building block in a way. It has a lot of molecules in that you can do a lot of different things with, not just heat your home with it, but you crack the molecules apart and into some smaller molecules, one of them being ethane. It's a hydrocarbon, fairly simple molecule, but it's a building block for plastics and a lot of other things.
I was going to say.
So the natural gas comes in, the ethane comes out of this plant, and some other byproducts that can be used. When I was with the chemical industry, I always said, we look at hydrocarbons like Native Americans look at the buffalo. We use every single part of them. And that's what they do. They break down the molecule and use other parts of it. Yeah. But the plastics industry really started in Ohio and Pennsylvania. And so we still have today up in Erie and over in Cleveland, plastic plants that make all kinds of bottles and containers and the little deodorant things. If you screw up the bottom of a container and deodorant comes out of the top, it doesn't matter what the product is.
Yeah.
That container probably came from Erie, Pennsylvania. But also the tool and die makers. So that's new money that will come into Pennsylvania.
I get it. Let's talk now about the budget.
Yeah.
Here, a couple things are clear. Governor Wolf's not getting 11% increase in the budget. He's not getting $2 billion. The budget right now, current budget, was 2.8% increase over last year. That's the budget right in place now. Where do you see this going in terms of the compromises that have to be made?
It sounds like the leaders of the four caucuses and the administration are really close. That they are going to be right around the June 30, July 1 date. May go a couple of extra days just because of the mechanics, which is not uncommon in Harrisburg. But looking at something like a 31 point something or other billion-dollar spend. Modest increases here and there.
Percent and a half,
So one of the things that they like that everybody can like about the selling wine is it allowed them to book those revenues.
Yeah.
So they're booking revenues for increased wine sales and
about $150 million is the number I read.
Which coincidentally happens to be what the governor wants in new education spending.
Only $150 million.
Well, he would have loved more, but he would certainly take $150. I think his people have told him to be pragmatic this year.
Yeah.
I think a lot of people are being pragmatic. So the numbers are coming together. There's going to be some things I'm not particularly thrilled about in my members. A little of this business tax over here, a little of this business tax over there, but they won't do broad-based.
There'll be some niche taxes to help pay for it. I actually would be surprised if the budget did not extend to maybe 2.5. Look, it's 2.8% now. If they didn't get over 2 to 2.5, using some other niche taxes that they might find. There won't be, you would agree with this, no sales tax hike, no income tax hike.
No personal income tax hike this year or anything.
And also, I would be surprised if they didn't get maybe to $200 million. I think they're $200 million now for education. If you count $50 million.
Well, I'm just looking at the basic education fund.
The basic, sure.
Right. So you add some special ed money in there, add some other things. Sure, they will be that. And look, I'm not saying the governor wouldn't want more, and the other people wouldn't. Of course he does. And I'm not even going to say he's necessarily wrong, but
am I right about this? Nobody wants a repeat of last year.
Correct.
It's election season. Correct. Even though many lawmakers don't have opponents there.
No. I mean, the Republican leaders, even knowing that, look, the Republican Senate. The Senate will still be controlled by Republicans. The House will still be controlled by Republicans.
Here's the Madonna theory on this. The real budget deadline is the opening of the Republican convention in Cleveland.
yeah. Because a week later is the Democrat convention. No, I mean, in seriousness, both parties have to go to their conventions and want to go to their conventions.
But they don't want the narrative that they haven't done a budget, right? To be shown at cocktail parties and, doing what they do at conventions, all right?
Yeah.
I didn't get a chance to talk about this, but this is your last visit, perhaps.
Last appearance in this as the president of the Pennsylvania Business Council. Anyway, we're merging with the state chamber. It's a great thing for the business community.
All right. Well, we'll get you back in some way, I'm sure. All right. We'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.